guys, it's Sandy here with Freedom Warrior Fitness, and I wanted to check in with you again about the hip labral tear. I am 7 weeks out from my operative time, and I am vacationing down in Florida right now, trying to get a little recovery time in, and I thought I would check in with you guys and tell you how things are going. Been walking the beach, and I'm fully capable of walking. However, I found that after walking once on the beach without my crutches, it's not a good idea. So 7 weeks out, and I am definitely taking 2 crutches down the beach, making sure that I am putting all my weight through my operative leg, not letting the crutch do all the work, but letting it help out enough that I don't feel like I'm going to overtax it. So I did find that when I was out there the first day, I definitely overtaxed it some and created some pain deep in the groin area where the actual surgery was, and I'm not looking to do that. So definitely have to be careful with what I'm doing. So 2 crutches, been still doing all my PT, and that has increased. I'm excited. I've got pretty much about 50% use of my hip flexor as far as trying to pick my knee up off of the bed or off the table that they use for PT. And that comes in real handy because I like to be able to put my shoe on instead of having to bend all the way over down to the floor, which I still have to do sometimes. I am actually going to bring that knee up a little bit and put my shoe on. So that's a big plus, you know, when you go 7 weeks without putting your own shoes on and let somebody else do it. I do find out to be really careful now that I'm off my crutches in the house and walking around, that I have to be mindful of making sure that I'm putting heel toe, and not shuffling along. I don't want my gait to be impaired because that will cause other problems. One thing I have noticed is that I was dealing with a lot of SI joint pain on that operative side right through my back, and that pretty much went away when I was non-weight bearing. However, now that my weight bearing has come back, so has the SI joint pain. Not real sure what's up with that. Probably it's because I need to strengthen the glute medius, obviously my hip flexor area, but basically like the whole hip girdle just really needs to be strengthened, and so I'm gonna size it up for that for right now. That's my hope. I do my best to not irritate that and aggravate it too much, and I am doing what I can to increase the strength in that hip, but there's not a lot you can do right yet. I am doing some regular hip thrusts and some single leg hip thrusts, so that is hopefully helping, and then eventually when I get cleared for it, I will begin to do some medial glute PT, but I'm not quite at that point yet. I don't have very much range of motion, which is a little stinky. Apparently my PT is going to start working on that at around week 8, going into week 9. So that does tend to pose a little bit of a problem when I'm walking around the house. If I change directions too quickly, I can tend to kind of kink it, and that will hurt for a while. That tends to flare it up a little bit, so I have to be careful. The other thing that I'm finding is, I know if you guys have not watched some of my other videos, I talk about the blood clot scare. Around week 2, I began to get some serious pain in my calf and was doing all of the ankle pumps that I'm supposed to do, rolling it out, but was not having any relief from that. And that pretty much went on for about 4 weeks. Once I got cleared to start putting weight on my foot, I did notice that began to dissipate some, which I was really happy about. I did actually go get a blood clot scan, and they didn't see anything. So my PT kept telling me that it was probably just a circulation problem, and I needed to, once I was able to start moving on that leg. So I'm week 7, and this whole week's been great. We've been down here in Florida, but the last couple of days, that cramp has come back, and it's come back higher up in the calf. So I'm not real sure what's going on with that. I I am still doing my exercises, taking my aspirin, making sure I do have an appointment on Monday with my surgeon, so I will talk with him about that, but it's definitely not something to play around with. I'm going to get it looked at again, I think, just to double check, make sure I don't have a clot going on that maybe they missed, because that would not be good. As you guys know, blood clots can break up and travel into the lungs or up into the heart, and mine is definitely on my left, so I want to be careful. Also, I told you guys I would put together a video about my top 10 tips prior to surgery and top 10 after. And I'm out here on the beach and don't have my notes with me, so I'm going to wing it and tell you some things that would be good for you to do prior to surgery. So number one, get yourself educated. If you think that you have a labral tear but you don't know, but you're getting that deep groin pain, no matter what you do, when you walk, when you squat, when you turn, and it kind of can keep you up at night, my suggestion to you is first, go see a surgeon, a qualified surgeon, and get an MRI. Now, just because you have a labral tear doesn't necessarily mean you need surgery, but if you have been diagnosed with one and your surgeon is saying, yes, it's the only thing we can have left to do, then I would tell you to start looking at the surgery. It would be good for you to be educated about what the surgery looks like, what other people have done, how it has helped them or not helped them, what the pros and cons are for you, and really go into it educated, because it is a risky surgery. There's no guarantees. There's no guarantee that it's going to help you. There are some great testimonials out there, but there's also other people out there that have had their surgery and are not getting the results that they had hoped. So you want to go into it with informed. So that's number one. Number two, you want to make sure that you are it's getting chilly out here. You are as in shape as you possibly can be. So I always encourage people to do prehab. And prehab would be doing any type of lower abdominal work, if you can do it, to increase the your TVA, which is your transverse abdominis. And if you have any questions about that, just put them below and I'll explain that to you. But if you can do some kind of exercises that will help keep that area and that girdle nice and tight for you, because that's what helps to keep our hips stable. Also doing any type of glute work that would also keep your hips stable. I know sometimes when you're at this point and your labral tear is hurting, sometimes that's a challenge, and I get that. If you can do some of the band work that you would typically get for PT afterwards, that would be a good idea too. So that's tip number two. Tip number three, prior to surgery, make sure you're staying nice and hydrated, especially within that week going into surgery. Hydrate, hydrate, hydrate. Okay, tip number four is make sure that you have lined up someone to take you to surgery. They won't even let you come out if you don't. And someone to make sure that they stay with you at least for that first 24 hours, if not for 72, because you are so drugged up for pain medication that it's really difficult to get in and out of bed. And you can't even, there's no way I could even lift my leg out of bed. So I had my daughter with me and my husband, and they were a huge help. So you want to make sure that you have that. Tip number 5, if you're a girl, shave your legs, because it's going to be a while before you can do it again. So, or go get them waxed if you want to. That's my girly tip for you. If you're a guy, don't worry about it, obviously. Tip number 6, you want to make sure you have one of those potties that you can take and put on your toilet in your bathroom, the extended potty, because you're not supposed to bend over 90 degrees forward, and that can be difficult when you have to squat down to get on that other potty. So get one of those, you'll be glad you did. Also, they're probably going to give you crutches when you leave the hospital, but I don't suggest you use them in the first couple of days, because you're in a lot of pain, and if you're not in pain, you are really doped up with drugs, and it's really hard to navigate crutches. So I would tell you to get a walker. You can get them usually from Red Cross. You can call the Lions Club. They're usually free. You can just, you sign them out and you take them back, or find somebody in your neighborhood, your grandma, somebody that's got one, and don't be afraid to use it. It was a lifesaver for me for like the first 3 days. And then once I was able to get off the opioid drugs, which make you feel awful, I was able to then, use my crutches. So that was tip number 6. Tip number 7, clean sheets. Because you know what? There's something about getting into bed with clean sheets. That's all I got to say about that. Tip number 8, make sure that before you go into surgery that you are, you're not sick. You don't have a cold, you don't have anything going on, you've taken care of all that. Make sure you take care of letting everybody know where you're going to be so that you don't feel like you've got to answer phone calls or emails, those types of things. Get all your bills paid up, ahead of time so that you can really focus on healing for your body, okay? Tip number 9, when you are coming home, well, I guess that would be after surgery. I'll save that one for the after surgery tips. So tip number 9, prior to surgery, making sure that your home is like you've already prepped your meals, you've got stuff in the fridge that either people can make for you or that you can just pull out so that you're not having to worry about, if you got a family. I have 5 kids, I'm not having to worry about feeding everybody, that it was just there, they could pop in the oven, or they could feed me for that matter, because let me tell you, you do not feel like getting up and doing anything like that. And tip number 10, prior to surgery, make sure if you're a girl, your hair, your nails, and your legs are done. Yeah, because I always say they work better on pretty people. So there you go. And you eat chocolate, all the chocolate. So there's my 10 top tips prior to surgery. Some are conventional, some are unconventional. Take them, do with them what you want. I'm looking forward to where I'm headed now, going into my 8th week, and I will put out top 10 tips for after surgery. Those are important so that you can have a good and successful recovery. All right, you guys are awesome. If you have any questions, pop them down here. I love hearing from you guys, and we are excited to be where we are. Let me show you. Like, who doesn't want to recover at the beach? All right, peace out. Okay guys, we're on the beach today. Daddy went to get my crutches because I'm having a hard time walking too far, but it is absolutely beautiful. Pretty warm in the sense of warm for a chilly day, but it is so pretty. The white sand beaches are amazing. Nice, hard packed, almost nobody on the beach. The water is crystal clear, and it's definitely the best place to recover. Wishing you guys the best.